All right, thank you.
Okay, you're welcome.
Hey, y'all, it's Dr. Manny. Thank y'all so much for having me today. I'm really grateful. I hope everybody can hear me out there. Marshall County. Just wanted to take some time. I wish I could be visiting with all of y'all out there, but just with this coronavirus issue, it's been challenging. So I just wanted to take a few minutes and tell you about who I am and why I'm running, and then I'll maybe take some of the questions that y'all have given me. My parents, it all starts with them. They were immigrants from India. They grew up with nothing. And when they were kids, their homes were burned to the ground by Muslim radicals. They lost everything they had. Grew up early on homeless, and then pulled themselves up by their own bootstraps to become doctors. My mom would go to these villages in India without electricity, without running water, see patients. She'd nanny the other part of the time. My dad, he'd work all these odd jobs, and he'd sleep in the back of his car, see patients during the day. But, they both got through medical school, and they realized that, India was not going to be the place for their unborn kids. So they did what a lot of people did back then. They went to the U.S. Embassy. They stood in line and waited their turn. And in the 1970s, they came to this country legally with an L. Now, I got to say legally, because when I first started out, I've never run for public office. And after one of these speeches, this guy comes up to me and goes, "Well, did your parents come here legally?" I was like, "Yes, sir." And he goes, "You're not an anchor baby, are you?" I was like, "No, sir." So they came here illegally, and in the 1970s, moved to Cleveland, Ohio. And, that's where I was born. And at the age of 4, we got on this semi-truck and we rolled on down to Coffee County, Tennessee. And that's where I was raised. And my parents were doctors to farmers. My dad was a primary care doctor. My mother was an OBGYN, and so she delivered babies and babies of the babies. My dad, I used to travel the back roads with him. And I remember one night, we went to see this old farmer who was having chest pain. And we rushed him to the hospital. My dad's big old blue Delta 88 Oldsmobile. So we take him to the hospital. We get him there. My dad runs him inside. I'm 10. I'm in the backseat of this car. I watch my dad come out, and he says, I saw him talk to the family, and he wouldn't take any money from them. He says, "Son," when he got back in the car and I asked him why he didn't take the money, he said, "It doesn't matter what's in your bank account, but what matters is the difference that you make." And that's how I was raised, in a small town, watching my parents doctor to farmers. And then, boom, when I was 22 years old, I lost my dad to liver cancer. And that was a really hard time for me. And I felt like everything was just going wrong. And I felt like I was in quicksand. And I don't know if any of y'all have lost your parents who are watching this when you're young. It does a number on you. But for me, it's when I found Christ. It's when I found my faith, and I realized that I wanted to be a doctor too. So I went off and did that for the last 10 years. I've been a trauma surgeon at Vanderbilt. And, what I see every day is the thin line between life and death. So, hug your loved ones, tell them how much you need them, tell them how much they matter to you. In this era of coronavirus we're in, it just teaches you that, the Lord is all powerful. And we have to make the biggest difference we can in the time we got. And I felt like I was doing that as a doctor. About 9 years ago, my wife, Manny, we created a nonprofit called Healthy Tennessee. We've been taking care of patients all across the state, trying to get them on the front side of health. We've been out in Marshall County seeing patients. The president heard about this, and so he invited me to the White House and talked to me about Healthy Tennessee. He couldn't remember Manny, so he nicknamed me Tennessee, and spoke at one of his rallies. I'm in full support of our president. I think he's done an amazing job, and I'm praying for him this difficult hour I know our nation faces. It felt like I was making a difference there. But now with this open U.S. Senate seat, I feel like it is a generational opportunity to make a difference, a different kind of difference. That's what I want to talk about a little bit with you right now. We face a lot of challenges in this country, and I want to talk to you about a few of them. The first one is obviously this coronavirus that we face. Right now, our national economy is shut down. People are at home. We're losing jobs. Unemployment rate's 11%, going to climb to 13. Our GDP is down. We got to get America back to work. Our campaign has a plan, a vertical containment plan to protect those who are at risk for this disease, but to get everybody else out and back into the ball game in the coming weeks, as the president and the governor have suggested. Here's the thing, folks. If this has taught us anything, it is that we are too reliant on the communist Chinese government for our health. Our supply chain, gloves, gowns, masks, our medicines. So many of our medicines can't be made in this country, and we need to stop that right now. What if I told you that all of our oil was made in China, or was found in China? What would you say then? So we need to fix that. Dovetailing into that is Obamacare, my friends. It shows you the complete failure that happens when government gets between a patient and their doctor, or government gets in the insurance market. We need a free market-based plan that focuses on transparency in pricing and prevention. If I'm your next U.S. Senator, we will repeal and replace Obamacare with that kind of a plan. Finally is illegal immigration. Listen, I'm the child of two immigrants. My parents came here legally. They followed the law. My mom, when she watches Fox News and hears about illegal immigration, man, she gets so mad. And she'll tell you this. I stood in line. I waited my turn. It is not racist to talk about illegal immigration. We need to have that conversation. And we're just not. So if I'm your next U.S. Senator, we get rid of chain-based migration immediately. We put in a merit-based system. And the thing I'd ask y'all to think about tonight is this. Should we pause all immigration in our country right now, legal immigration, until our own American citizens, our own people, can get jobs? But the bottom line is this. I love the Gospel of Matthew. And Matthew 9 teaches us the harvest is plenty, but the workers are few. My whole life, I've tried to be a worker. I've tried to make a difference as a doctor, running a nonprofit called Healthy Tennessee. That's why I want to make a different kind of difference as your next U.S. Senator. And y'all have a very clear choice before you in the coming months on August 6th of who you're going to choose to be your next senator. It's like choosing your doctor. On the one hand, you have a Washington insider, someone from the sort of the Mitt Romney school. And on the other side, you've got someone who comes from the outside of government, someone who spent their whole life serving the people of our state. So I'm asking you tonight to help me, to join my cause and to help our campaign. 40 years ago, folks just like you in a town just down the road, Coffee County, you gave these two immigrants from India a chance. And, 40 years later, the kid of those two immigrants, I'm here tonight on Facebook Live because I can't be with you, asking you for your support to help this outsider, to send me to Washington. And let's fight together to solve some of these problems of our time, of this coronavirus crisis, of healthcare, of illegal immigration. Together, I know we can do it. Well, thank y'all so much. There are some questions that were sent out, and I want to kind of go through some of them and answer as many as I can. So the first question is, what are the current coronavirus mitigations you would like to see continued? Well, the problem with the coronavirus mitigation right now is that we have a horizontal containment strategy. And what that means is that we shut everything down to save a few lives. Now, just think about this for a minute. We are shutting down an entire economy to save lives on the front end. But how many lives are we going to lose on the back end of this problem? All right, people who are going to commit suicide because of unemployment, people who can't get their mammogram that they need or the colonoscopies that they need because the hospitals are closed. What we need is a vertical containment strategy, folks, and that is to protect those people who are at risk specifically. Now, the mitigation factors that I think we're going to have to keep on hand for a while is this physical distancing of 6 feet. I do think it's important. I've seen it in the hospital. I've seen it be effective. The numbers are coming down. But we got to get America back to work, and I'm prayerful that we can do that in the weeks to come. So thank you. The next question. Your website says you'll fight to repeal and replace Obamacare. Replace it with what? That's a great question. So I addressed a little bit of that in my talk, but look, here's the thing. We need three things if we're going to fix healthcare in our country. The first one is we got to get government out of the way. All right. We need a free market-based healthcare system with pricing transparency. Right now in healthcare, nobody knows what we're paying. In healthcare, I'd like to say there are the three Ps: the patient, the provider, and the payer. All right, three Ps: patient, provider, payer. And none of those people actually know what we're paying. And I apologize, you can probably hear my kids in the back going crazy. But nobody knows what we're paying. So what we need is this pricing transparency. People got to know what we're paying for so we can be competitive. That's number one. Number two is we need an individual insurance market without the hand of government. So I think some of these large employers can give the money back to their own employees, let them go to an individual insurance market and give them more independence, more choice and options. Let them choose their own insurance. And I believe that what will happen overnight is if we can compete across state lines, we get rid of these essential health benefits, we'll flood the market with different products, and prices will go down, premiums will go down, deductibles will go down, and I think it would be really good. But the third thing is this. And this is something that people just aren't going to tell you, these career politicians and Washington insiders. And that is that we're paying to treat disease, folks. We're paying to treat disease. We're not paying to promote wellness. And that's a big problem. We could spend $1 on the front end to talk about diabetes education instead of spending $10 on the back end. There's no sense of that. But look, doctors, healthcare providers, everybody, we've just been in a system too long that promotes treatment of disease and not promoting wellness. So that's that question. What is your view on the need for our second amendment? Well, I got a carry permit in my pocket. About 5 years ago, I had a death threat against me. No one would help me. So I took a gun safety class. I got a Glock. And that's my view on the Second Amendment. It's our right. It's a constitutional right. If I'm your senator, I'll protect it. That simple. My views on abortion: I am pro-life. Period. No exception. Do you support Israel? How do you think the U.S. should support Israel? Well, here's the thing. I lived in North Africa for a year, taking care of kids with muscular dystrophy when I was in my mid-20s. And I'm just telling you, Israel is the grown-up in the room. They're the single country that stands between us and Islamic radicalism. And we got to look out for them. We got to provide them the weapons we need. We got to protect them against Iran. We can't allow a nuclear Iran, which is why I'm so glad that the president repealed the JCPOA and wasn't a part of that anymore. I think that was absolutely the right move. But Israel is our ally. If I'm your senator, you will have no greater friend in Israel than me. All right, next question. What is your stance on red flag laws? I'm totally against them. I think that it's an infringement on our constitutional rights and on due process. I just think there's no room for red flag laws. And just think about this, folks. Think about the doors that would open if you allowed red flag laws. Someone who doesn't like it, they could say, "Oh man, that guy's crazy." Next thing you know, they're in your house taking your guns away. It's not right. Okay. How will you decide on voting for or against Supreme Court nominees? That's a really good question. Look, I will vote for someone who interprets the Constitution as it is written. I'm an originalist. Someone who protects the Second Amendment. Someone who protects the life of the unborn. Someone who doesn't try to legislate from the bench. And someone who shares Tennessee values and celebrates our Christian values. I think that's important. Next. Do you support deporting illegal aliens? Oh, that's about the easiest question in here. Absolutely, I do. What do you think of the UN and the U.S. role in the UN? I think the UN doesn't do their fair share. We fit the bill for these people, and it's time that they pay up and participate more. Why is it that in UN missions all the troops have to be American. That's not right. These countries need to put in their own effort, their own resources. It's not fair. Next question. How can we expect you to vote on gun issues? Are there any common sense gun control laws you'd like to see enacted? Look, I believe in the Second Amendment, and I think it's our constitutional right, and I will always protect it. As a trauma surgeon, I always see people cleaning their guns and accidentally shooting themselves. So when they're cleaning their gun, it's like my big fear with me too. So I just think we just need to help people with gun safety, and I don't think that's necessarily a state role or a federal role or anything, but I think it's a private thing. But I've just seen bad accidents, and that would be the only thing, is just teaching people how to use their weapon appropriately, how to clean their gun, etc. Would you consider pushing for firearms and life skills education in our public education system? Yeah, sure. I think education is a local issue, and if on a local level people felt that, yeah, that's fine. I don't think, as a senator, the federal government has any role telling you what you should or shouldn't be doing in your local public school. That's my feeling. What do you think of the WHO's handling of the COVID-19 pandemic? I think it was awful. I think they sat on the Chinese data for a long time, watching these folks do what they were doing, and they didn't report it. And now we have a pandemic, and I just think we should defund the WHO, which I believe the president's going to do if he didn't do it already today. Where do you stand on charter schools, vouchers, and homeschooling? Well, I'm getting a little taste of homeschooling right now, but I've always been supportive of it. I believe in school choice. I think, though, we don't help our parents and support them enough who want to homeschool. I had a friend recently who just felt there was no good Christian school for their kids, and they decided to homeschool, and I watched them struggle. And I think we need to think about that more and help folks who want to do that, because I think it's pretty amazing. What do you think of the role of the federal government in K through 12 education? What do you want to do as a U.S. Senator regarding K through 12 education? Well, I kind of answered that a little bit. I just think that education is a local issue. I think Common Core was the biggest failure we've seen as evidence of the federal government being involved. What I'd like to see as a senator, I do think vocational, technical, agricultural education and supporting that, like we're doing in Tennessee and other places, would be great. Having said that, again, I don't think the federal government has a role to tell you what to do or what not to do. And so I think that my role as a senator, the clearest I would see, is to keep them out of your hair and keep them out of your local school boards. Next question. What specific steps would you take as a senator to remove government intervention from healthcare, from the healthcare business? Man, this is something I deal with every day. Fighting with insurance companies for my patients. This is wrong. And I just think government intervention is why we got to where we've gotten to. It's very simple. Prices are going up. Outcomes are going down. You're paying more for less. And that's because of these increased regulations. And I think the closer we get healthcare to a free market-based system, the better it will be. And that's why I think that's what we need to be doing. And someone wrote, "Do you mean like it was before Obamacare?" Yeah, I think, but I do think we can also do it better. I think we can have more choice, more options, more transparency. There's so much more that we could do with health. I would like to know more about your views on the use of our military overseas and where you stand on our role in the Middle East. Well, in terms of our military, first of all, any veterans who are watching this, thank you for your service. I've taken care of veterans who came back from theater in Afghanistan, Iraq. I've had to cut off people's legs who had bad IED explosions, talk to their families, and the sacrifice they make is incredible. My view of military intervention is that it has to be in the direct national security interests of our country. I think we are not the world's police. We are not. We don't develop other people's states. That's not what we do. We protect this country, America first. And so I would try everything I could diplomatically, as for example, the president did in Iran with this General Soleimani. But at some point, when our national security is at risk, like they were going to attack our U.S. embassy in Iran, we had to react. And so that's my feeling about the utilization of military power. And I don't say that lightly because these are people's children, their mothers, fathers, brothers, sisters. I know because I've operated on them. As far as foreign policy in the Middle East, like the Middle East is a dicey place. And I just think we have spent so much blood and treasure in Iraq and Afghanistan. I just think it's time to bring our troops home. I applaud the president for what he did in Syria and pulling our troops back. Because look, I mean, how many more lives are we going to lose? And I just think, with this problem of Islamic fundamentalism, we have to protect our own national security. And I think we've done that, and it's time to bring our boys and girls home from the Middle East. And I lived there for a year, and I know how treacherous it is. Would you consider pushing for firearms and life skills education in our public education? We talked about that. Yes, I think I would, but that's up to you at a local level. I think that question was asked twice. Hold on. Do you support the Dreamers or a pathway to citizenship for illegal aliens? I don't. That's simple. What do you think about tearing down of historical statues from the Civil War era? That's a great question. Condoleezza Rice said it best. She said, when people start sanitizing our history, that's when we should start being worried. And I just don't think we can let political correctness destroy the past, no matter what people think about it, and for better or for worse. And so I'm against taking down any monuments or statues. Are there any issues, policies with which you disagree with the president? Well, I think he's doing a great job. I know he's going through a lot right now. Just watching him on TV, you just can see the stress. He's, and just trying to do the best he can in real time. What I would say is I think he's done a great job on illegal immigration, but I think we could also go further. And I think we have too many H-1B1 visas. Those have increased. And I want to see us move more quickly to getting rid of this chain-based migration. And I know it's hard because he's got to deal with all these Democrats. So it's not necessarily disagree. It's just I wish that we could do more with immigration. And if I'm your senator, we'll do that. Because look, it's not racist to talk about illegal immigration, guys and gals, period. Do you believe our current public education, such as standardized testing, is efficient in testing our youth? I don't, because here's the thing. Who is making these standards? That's my question. I mean, if they were useful standards and we figured out a way to all agree on what they are, then sure. But if the federal government's making these meaningless questions and tests and standards, what does that mean? I mean, that just gets back to the failure of Common Core. So no, I agree with you. Next question. The military spends millions of dollars every year training and investigating members. Would you consider fighting for those highly trained and qualified members to skip the red tape in state and federal jobs so there can be not only expanded hiring process, but also cost savings? First of all, I agree with you. I've seen so many of our veterans who come home, can't get jobs, and so we need to cut through the red tape to help them. And I think certainly what you're saying makes a lot of sense to me. I'm all for cutting regulation and red tape, but the overall point is that I just think we need to support our troops who put their lives on the line for American freedom, and you will find no better advocate for our veterans than me. So there was one last question here. Will you support mandatory vaccinations against this terrible virus? Why or why not? Well, we don't have a vaccination yet. We'll probably have one in September, but I'm not a mandatory vaccine guy. Look, I think it's a personal choice for parents and for families. There are some vaccines that Maya and I gave the kids. There's some that we didn't. But I think that is up to you. And as a physician, it's not my place to tell you that. As a senator, it's certainly not my place to tell you that. Now I can, advise you about the risks and benefits. My worry about a coronavirus vaccine is, we'll just have to see what are the the downsides of giving it? What are some of the reactions that people have to it? And I think that's kind of what we need to think about. So with that, those are all the questions I had. I just wanted to thank everybody for being here with me tonight in Marshall County, and I'll be out there with you again soon. If I can help any of y'all, and I mean it. This is why I went into medicine. Just call me. You can email me at Manny@drmannyforsenate.com. You can reach me on my phone, 615-200-7195. And our website is drmannyforsenate.com. But look, I know right now is a trying time. You're worried, and so am I. But you just got to remember the Lord has each of us in the palm of His hand, and just don't forget that. And even in the darkest times, if you're struggling with your job, we'll get through this together as a country, as Tennesseans. And I'm here for you. God bless you all, and thank you so very much.